All right, welcome to the explainer. Now, if you're in the dental field, you know just how critical a good clinical photo is, right? But here's the big question on everyone's mind. With smartphone cameras getting just unbelievably good, do you really still need to lug around that big, bulky DSLR? Well, today, we're diving into a really cool pilot study from the Journal of Dental Sciences. They put the gold standard DSLR up against the latest smartphones for intraoral photography. So let's see if that device in your pocket can finally take the crown from the Pro Gear. Okay, so here's what we're going to cover. We'll start with a quick reminder of why dental photography is just so fundamental to what we do. Then we'll jump into the study itself, the who, what, and how. After that, the main event, the results. We're going to break down the data and figure out what it actually means for your daily practice. And to finish things off, we'll talk about how to choose the right camera for the right clinical situation. All right, first up, before we get into the tech, let's just quickly set the stage. I mean, we all know clinical photos are a big deal, but it's amazing to think about just how central they've become to everything we do in modern dentistry. You know, this quote really hits the nail on the head. It calls dental photography the best standard for learning from your own mistakes. And that is so true, isn't it? It's like the most honest mirror you can hold up to your own work. But of course, its role in our practices goes way, way beyond just that. I mean, just think about it for a second. It's an absolutely crucial part of our daily workflow. We use it for diagnosis and treatment planning, for communicating those super specific aesthetic details to our lab technicians, for legal documentation. I mean, the list goes on. Publishing cases, and maybe most importantly, for showing our patients what's going on and educating them. It's the whole shebang. Okay, so that brings us to the big showdown. Our smartphones have these incredible cameras now, right? So this study from the Journal of Dental Sciences asks the one question that pretty much every single clinician is thinking. Can a smartphone truly replace a DSLR for the high-stakes world of clinical photography? So let's meet our contenders. In one corner, we have the undisputed champion, the gold standard, a Nikon Z5 DSLR. We're talking full frame with a 105mm macro lens and a twin flash setup. And in the other corner, the challengers, three of the latest smartphone powerhouses, the iPhone 15 Pro, the Google Pixel 8, and the Samsung S24. Now, to make sure this was a totally fair comparison, the researchers were super careful. They took 5 standardized views for every single participant, and they controlled everything. We're talking manual mode, a fixed white balance set at 5500 Kelvin, and consistent lighting for all the cameras. Then they used software to analyze things like distortion and color. This wasn't just a casual snapshot contest, this was a properly controlled scientific comparison. And that's why these results are so interesting. So let's see what they found. Okay, now for the main event. This is the core of the study. Let's get right into the data and see how these cameras stacked up against each other. So first things first, distortion. This is a huge one. Basically, does the camera capture the tooth as it actually is, or does it kind of stretch or warp the image? You know how important this is. If the image is distorted, your measurements are off, and that can throw off your whole treatment plan. And wow, the results here are pretty dramatic. The DSLR is just in a completely different class. It has the lowest distortion by a long shot. No contest, really. So the big takeaway is pretty simple. The DSLR is hands down the winner for minimizing distortion. But among the smartphones, the Google Pixel 8 really stood out. It did the best job of keeping that tooth's shape true to life. Okay, next, let's talk about detail. We're talking about resolution measured in DPI, or dots per inch. All that really means is, the higher the DPI, the more fine detail you can see in the picture. And for diagnostics, that's everything. The industry standard, the number you want to hit, is 300 DPI. And this is where things get really interesting. When you look at the molar shot, which is always a tough one to get right, the DSLR comes out on top with the highest resolution. The Google Pixel 8 is right there with it, performing really well. But check this out. The iPhone 15 Pro actually dipped just a tiny bit below that 300 DPI mark on the molar. It's a small difference, but it's an important one. All right, now we get to what might be the single most important test, especially for anyone doing cosmetic work: color accuracy. I mean, how true are the colors? Can you actually trust what you're seeing on the screen when it's time to do a shade match? This is the big one. And this is where we got a bit of a surprise. The researchers specifically looked at value, which is basically how bright or dark the tooth is. And among the smartphones, the Samsung S24 was the clear standout. Its result was incredibly close to the DSLRs.
This is a really big deal. What it tells us is that Samsung's software seems to be really, really good at capturing that brightness component of shade. And as you know, getting the value right is absolutely key to making a restoration look natural.
Okay, so we've seen a lot of data, but what does it all mean for you and your practice on a Monday morning? Let's boil all of this down into some practical, real-world advice. So here's the main takeaway, the bottom line. Despite all the amazing advances in smartphone cameras, this study really confirms what many of us suspected. For those really critical jobs that demand precision, the DSLR is still king. The optics and the control you have just can't be beat. So, when is a DSLR an absolute must? Well, think about medical legal documentation, or when you're submitting images for publication or research, and definitely when you're trying to communicate a complex shade for a big aesthetic case to your lab. In those moments, the accuracy and control of a DSLR are, well, they're non-negotiable.
But hey, that does not mean you should throw your smartphone out the window. There are plenty of times when it might be the perfect tool for your everyday patient records, for quick before and after to get a patient excited, or just tracking the progress of a simple case. The convenience of a great smartphone is just unbeatable. It's fast, it's easy, and it's a super efficient option. All right, let's bring it all home with one final thought on how you can use this info to pick the right camera for the job.
And honestly, the study's authors say it best. If you choose to use a smartphone, you just have to understand its limitations. To get the absolute best clinical results possible, you have to standardize your process. That means using consistent lighting, good retractors and mirrors, and digging into those manual camera settings to take control. That's how you'll get the most out of it.
So this study gives us a fantastic, clear picture of where things are right now. The DSLR still holds the crown for high-precision work, but you can see that the gap is definitely getting smaller. And it leaves us with this really fascinating question for the future, right? With AI and computational photography moving so fast, what's it actually going to take to finally dethrone the gold standard? Just something to think about. Thanks so much for joining me for this explainer.